Well, hello, everybody, and Happy New Year. Thank you for joining us today. A lot of really important information about the virus in our state, the vaccination programs, schools today to go over. I'm here with Jill Hunsaker Ryan, the Executive Director of the Department of Public Health and Environment, who will be joining us in a few moments to talk about some of the logistics. But first, I want to share our latest COVID numbers. Today, 2,557 new cases, and we have 911 people hospitalized. So the virus is extremely prevalent across Colorado, across America. We are not yet experiencing the same peaks that we're seeing in some other states like Arizona and California, but that, there but for the grace of God go I, that could be Colorado if we let down our guard. What does that mean? Avoid socializing with people outside of your household, wear a mask around others, keep a distance of 6 feet. Extremely high viral presence continues. And I also want to express my condolences to the families and friends and loved ones of the 3,986 Coloradans who have passed from this deadly virus. We continue to monitor this on a daily basis, and it's all in the hands of the choices that people make individually and collectively to avoid socializing with people outside of their household and wear masks around others. We really, in the final, with the light at the end of the tunnel here, we're going to talk a lot about the hope of the vaccination and what's being done every day and the tireless work to get that into the arms of people and be one of the leading states in successfully deploying the vaccine. But does not yet have a significant impact on health. I think we're at about 2% vaccinated, and that 2% does not yet have immunity. Only the very first people are getting their second shot now. Remember, first shot, 21 or 28 days, depending on the shot, 2 more weeks, then immunity. So a month and a half from that first shot to immunity. And so we're at 2% who have at least received that first shot, just over 2%. This is my first press conference of 2021. I'm excited to provide you with an update on the progress that we've made getting Coloradans vaccinated, the plans going forward. We want to clarify how Coloradans 70 and up can access the vaccine. That's been a question a number of folks have asked. We're going to give you some easy places to sign up and information on how to get it. It is as we finish the phase 1A, and there are still people in 1A, medical professionals that work around COVID patients that are still receiving it, but many areas of the state have already begun inoculating folks in the community age 70 and up, and I'll give a few examples of that great work. And it's good to say we're ahead of the curve compared to the rest of the country. We've consistently been in the top tier of states in successfully getting the vaccine into arms, but this is not an exercise that is graded on a curve. We need to do better here in Colorado. The entire nation needs to do much better. And today we're going to talk about some of the steps we're taking to do an even better job of really maintaining Colorado in a leadership role nationally and successfully getting the vaccine into the arms, particularly of the most vulnerable people age 70 and up. Vaccines are truly the gateway to saving lives. And the sooner that we get folks vaccinated, the quicker we get back the Colorado we love, the sooner we get back to some sense of normalcy. And this pandemic has had a toll on everybody in our state, right? Obviously, first and foremost, it's health. It's the people that have not made it. It's the people that have been hospitalized after a hard fight. They've emerged still experiencing health problems. It's the friends and family of all of those who've experienced loss. It's about economics. It's about people who've lost jobs or hours because of the pandemic. And it's about social emotional loss and psychological isolation. I mean, think of the price paid by many of our seniors in nursing home facilities that have really been cut off but from their loved ones. Yes, maybe some visitations outside, but not able to have poker night with their friends and movie night. So there's been so much loss: health, jobs, social, emotional. And that's why it's critical to end this pandemic as quickly as possible. The vaccine is the key to doing that. And our top priority for our administration is to make sure that we have the infrastructure in place to ensure that healthcare workers and, of course, Coloradans age 70 and up can get vaccinated as quickly as possible. This is important for folks to know. Coloradans age 70 and up represent 78% of deaths and more than a third of hospitalizations to date. We have the opportunity to make a major impact in the death rate and the hospitalization rate of the virus by completing the program to vaccinate everybody age 70 and up. Then, of course, we can move on to other groups of key workers and those that are age 60 to 69 and others. Today, I'm going to walk you through phase 1A and 1B. These are the ones we're focused on right now. 1A finishing up, and in many places, 1B already starting. How many people we anticipate are in those phases, the timeline, how you get the vaccination if you qualify, how you get more information. Now, throughout this process, we focus on how we can save the most lives and end the pandemic and the public health crisis as quickly as possible. And that's why we prioritize our highest risk healthcare workers. They're on the front lines day and night. If they're out on a quarantine, quality of care can suffer. If they're out with COVID, quality of care can suffer, as well as residents and staff in long-term care facilities that have already started receiving their doses, and in many places in the state, people over age 70. But as we learn more about the vaccine distribution process, we get additional data and guidance from CDC. We've updated our prioritization list to ensure that we're getting the vaccines into the arms of our most vulnerable. Last week, I announced Colorado's updated vaccine distribution plan, which included changes to phase 1B and to phase 2. And as a state, we're currently completing phase 1A, and in many areas of our state, beginning phase 1B, age 70 and up. We remain hopeful that as we get through phase 1 this winter, early spring, move into phase 2 for the spring, general population will have access to the vaccine by summer. We moved up teachers and educators from phase 2 to phase 1B. So that's from an April-May timeline to a March timeline for educators. As soon as folks 70 and up, we've reached them. We're moving on to a lot of our key workers that have to be around many others by nature of the job they do. In phase 1A, we remain committed to vaccinating the most at-risk healthcare workers who are literally spending time in COVID wards and working directly with patients. And it's not just the healthcare workers, it's the maintenance worker, everybody who goes into those COVID wards, we want to make sure has this level of protection. And we're excited that at our long-term care facilities and nursing homes, residents and staff have already begun to receive the vaccine. That is the one area of the distribution plan that is not in our control as a state. There is a federal partnership, a federal contract between CVS and Walgreens and the nursing home and skilled living facilities. And we talk to them regularly. We are on them. We want to make sure they meet their timelines. We've asked if they need any additional state assistance to do so. And we know that the virus can be especially deadly for those in assisted living and nursing homes. Walgreens estimates that they will have completed administering the first dose in the nursing homes and skilled living facilities that have chosen them by next week. CVS estimates they will be done at the end of January, so 3 more weeks for CVS and 1 more week, next week, by the end of next week for Walgreens. So we will do our best to hold them accountable. Those are federal contracts, but I've had conversations with CVS and Walgreens executives, and we'll continue to make sure that they get any support they need from us to complete the successful inoculation of the staff and the residents at long-term care facilities. This chart shows how many Coloradans are eligible for vaccine under 1A. There's about 76,000 of the highest healthcare workers, 121,000 long-term care residents and staff. There's more staff than residents because these are very labor-intensive facilities. I think the estimate is about 30,000 residents, and I guess that would leave about 90,000 staff or so for a total of 187,000. Now, phase 1B. This phase includes all, these are as you know, the one that we changed last week. We upgraded educators and teachers, and this phase, of course, includes all Coloradans 70 and older, which represents 78% of the COVID fatalities in our state. The more quickly we can get people 70 and up vaccinated, the more lives we can save. 1B also includes people working in food and agriculture and manufacturing and the postal service and bus drivers and grocery and public health and human services workers, many, many others. The expansion of 1B aligns it better with the CDC guidance and prioritizes the vulnerable populations with the biggest impact on saving lives to make sure that they're at the front of the line. Phase 1B is a much larger group of Colorado's population than 1A. It's about 1.3 million people, right? 125,000 moderate risk healthcare workers, first responders, 562,000 Coloradans age 70 and up, and 628,000 frontline workers. So that's a significant group of people that we'll be focused on for the next couple months. To date, we've received 243,000 vaccines, and 127,000 have received at least one dose, with 129,000 total doses administered. Those are some of the second doses showing up, just a few thousand Coloradans that are starting to get their second doses, some of the very first people who received the vaccine. We're doing everything to get the vaccine out into arms. Something you should know about this is these will always have a bigger disparity on Monday, Tuesday. We receive the vaccines Monday and Tuesday, and then those need to last us through Sunday. So these numbers will be always closest together on kind of Sunday, Monday morning. And today being Wednesday, we received Monday, Tuesday, occasionally Wednesday morning. Part of the issue is we're not always sure. Originally supposed to be Monday, but that's often lapsed into Tuesday and Wednesday when we get the vaccine. So there will always be the largest disparity Monday, Tuesday, Wednesday, the smallest disparity Sunday. But again, we pride ourselves on being one of the top states in getting the vaccine into arms. The rest of the country needs to do better. We have the fierce urgency of needing to do even better as well and get it faster, particularly into the arms of people 70 and up. We're going to talk about some of the partnerships that will do that. We expect that by January 15th, we will have vaccinated most healthcare workers in 1A and residents and staff in long-term care facilities, skilled nursing facilities. All will have received their first dose. Most might be some additional work in the week or two after that, but most by January 1st, which means most of the state is then focused on the 70 and up. Doesn't mean there won't be some cleanup and some folks at a few homes or medical staff that missed it that are still getting it in late January. But by and large, the big quantities, the big focus after January 15th is 70 and up. There is 70 and up already occurring, but it becomes the bulk of the focus after mid-January. I'm going to turn it over to Jill Hunsaker-Ryan to provide more insight into how we're getting the shots into arms as quickly as possible in communities across the state. Before I do that, I just want to talk about sort of our equitable approach. And we had very successful clinics for 70 and up just last weekend. And I want to thank Rick Palacio for putting that together on short notice. We had Valley-wide Health partnering with the local fire department and sheriff's department to have a drive-through vaccination clinic for Coloradans 70 and up in San Luis and in Center, Colorado. More than 250 Coloradans age 70 and up got their vaccines. You can see the photos that we are showing here. These are exactly, if we can show the photos, that would be great. These are exactly the kind of event we are looking to replicate across our state. And there we go. Center, I visited the school there not too long ago, and it's exciting that most of the community members 70 and up now have their vaccines, San Luis as well. This is exactly the kind of event that we're replicating across our state in harder to access and rural areas, working with trusted organizations, could be a fire department, could be a hospital, community health clinic, pharmacy. We want to go to where the need is, and that could mean clinics at churches, school parking lots, workplaces. We're going to do everything we can to vaccinate Coloradans as quickly and equitably as possible. I want to thank all those who worked hard to have the successful clinics in San Luis and Center, and I'm happy to turn it over to Jill Hunsaker-Ryan. Jill?
All right, good morning, everyone, and thank you, Governor. For the past 10 months, this pandemic has been with us, and Colorado residents have made sacrifices and endured a lot. But today there's hope on the horizon. I'm so thrilled that we can now discuss vaccine distribution. 10 months ago, few would have believed that this is possible. The day has arrived quicker than history and science has ever allowed before, but it's a day that we have been preparing for. So in order to achieve our goal of saving lives and ending the healthcare crisis as soon as possible, our mission is to distribute vaccines as quickly as the federal supply chain allows, as well as getting vaccines into arms as efficiently as possible. Currently, Colorado's receiving around 70,000 vaccines per week. although we expect this to increase as new vaccines come on the market, hopefully in February and March. But we do ask for people to be patient, as not everyone who is eligible will receive a vaccine right away. We believe our distribution process will allow us to have the greatest impact throughout Colorado while avoiding waste. We are utilizing partnerships with local public health agencies, hospitals and other health systems, pharmacies, and community health center clinics. This is an enormous undertaking. In order to be quick and effective, we have to be flexible. Every county is going to look a little bit different in terms of what entity is providing the vaccination. And we're going to have to problem solve and be inventive as we go. In order to streamline vaccine distribution, we are dividing up the responsibilities for vaccine administration between local public health agencies and healthcare providers. As we finish phase 1A, local public health agencies will vaccinate any remaining healthcare providers or staff that serve COVID-19 patients. They will then ensure that moderate risk healthcare providers and staff and first responders in phase 1B have access to vaccines. In many communities, the local public health agency will be coordinating vaccinations in general. Everything is a partnership. For Coloradans age 70 and older, providers like hospitals and other health systems, pharmacies and community clinics, and local public health agencies will be administering vaccines. This may be by appointment or drive-through clinic. If you're in this age group, we encourage you to call your healthcare provider for further instructions. Also of note, the federal government is coordinating the vaccination of people living in long-term care facilities through a federal pharmacy program using CVS and Walgreens. So the next slide shows the phased timeline. Colorado received the first shipment of vaccine on December 14th, with the governor signing for it himself. Since then, Colorado has distributed vaccine quicker than the vast majority of other states. We are now in phase 1A, frontline healthcare workers and long-term care facility staff, and also moving into phase 1B in some areas, including ages 70 and older and moderate risk healthcare workers and first responders. We expect to be done with the state's portion of 1A by the end of the week. Residents of long-term care facilities are also in phase 1, and we are continuing to press the federal government to ensure the federally run Pharmacy Partnership for Long-Term Care Programming is operating with equal expediency, and we're even offering technical assistance. By the end of February, we expect to vaccinate anyone over age 70 who wants it. We will begin vaccinating essential workers like teachers in early March. This timeline, of course, is dependent upon receiving a steady supply of vaccine doses from the federal government. And while the limited federal supply means that not everyone will get it right away, with every dose administered, of course, we all feel a little safer. But a reminder that until vaccine is widely available and community immunity is achieved, we need everyone to keep following public health protocols, wearing your masks, and socially distance. Now's not the time to let up. There's hope on the way. Slide. And we are almost there. Because we want to save as many lives as possible, we're prioritizing Coloradans age 70 and up, a group that sadly accounts for 78% of COVID-19 deaths. As I mentioned, our goal is to vaccinate anyone ages 70 years and older who wants it by February 28th. We expect that about 20% of this group will get this vaccine through community partners and local public health agencies. 10% will get it through retail pharmacies, 20% will get it through federally qualified health centers, and because of our framework, about 50% will get it through a hospital system. Everyone who wants a vaccine will eventually be able to get one. From the beginning, we have developed a distribution plan using an equity lens. It aims to be responsive to the disparities that have been so pervasive throughout this pandemic. Disparities that have plagued society for years upon years, but are even more prominent during a crisis. We know that we must be deliberate about achieving equity, meeting communities where they are, and addressing vaccine hesitancies that are rooted in historical injustices. We've seen these hesitancies reveal themselves in our October 2020 survey, which showed, for example, that while 70% of white Coloradans plan to get the vaccine, only 53% of Black Coloradans and 56% of Hispanic Coloradans plan to get it. We are deeply committed to overcoming systemic barriers and having an equitable distribution process that leverages community partners who are anchored in their communities and trusted, and this includes churches, employers, community centers, and fire departments. We need them all to help make a connection with broader communities and ensure everyone has access to this vaccine. We are mobilizing the state's resources around this issue and have also asked the Centers for Disease Control and Prevention for even more support for continued outreach and community engagement. And now I will turn the slide presentation back over to the governor.
Thank you, and thank you, Jill. We're doing everything we can to reach Coloradans across the state, and I think certainly on the minds of a lot of folks that are 70 and up is how do you get it? So we're going to get into how you can sign up to do that. We're working with our major hospitals to get online portals going, and of course starting with the major systems, but many of the smaller ones are already coming online as well. I really expect that most of the hospital capacity in the state will be on online portal systems in the next week or so. So right now we're going to talk about UC Health, Denver Health, Centura as examples. Already they're contacting Coloradans aged 70 and up and older. By next weekend, by this coming weekend, we're expecting that UC Health, Denver Health, and Centura will have their online portal for Coloradans 70 and up already open for everybody. So UC Health is using My Health Connection. That's their online system, their online patient portal, communicating with patients. If you're a current UC Health patient and you don't have an active My Health Connection account, you can sign up to get one, and you'll be notified. Many people are notified if you've been to a UC Health facility, you're a patient. You can check your My Health Connection account. Denver Health is working to offer the COVID-19 vaccination to their patients 70 and over. They are, as we speak, and in the last few days and next few days, we're contacting, making appointments for their patients aged 70 and up who get care at Denver Health. Tickets to schedule their COVID-19 vaccinations are being generated in a phased fashion. If you go to Denver Health and you don't currently have a ticket, they just ask that you bear with them for a few more days, but they expect all vaccinations to be tickets to be available this morning if you've been to any Denver Health in the last 3 years. For any more information about that, denverhealth.org/coronavirus. Centura patients will get an invitation through their online portal, My Centura Health. That's their patient portal. These invitations are randomized for their patients that are 70 and up and sent out to schedule. It's randomized without any consideration and no discrimination based on ability to pay or race or color or gender. So those will be sent. They are sending those out as well. Appointments are required, to receive the COVID vaccine. They don't accommodate walk-ins. I think it's bring your spouse if they also qualify, because sometimes one of our requirements is don't waste any doses, and if there's one available, it'll likely be administered. But you do need an appointment. Based on allocation from the state, Centura is working through their current health folks, but then they are opening their portal to others shortly. Banner Health, depending on where you live, you can visit these sites and sign up as well. If that's your main provider, and if you've been there. Kaiser members 70 and up, and if you're eligible, visit kp.org/COVID vaccine. That you complete the COVID-19 vaccine sign up that they have. You give them your information, and then you are placed on their list that will be randomized, and you'll be notified of when you are up if you're 70 and up. For folks in the mountain, Vail Health coming online. They've been focused on successfully. I think they've scheduled over 500 folks over 70 for vaccination, and they're working on scheduling more as well. And then Boulder Community Health, another independent hospital, contacting patients aged 70 and up. So these are all either online or coming online. And then those that we don't have announced today. These are these are probably what 80% of the hospitals in the state, but by capacity. But there's others that will be coming online in the coming days. We're gonna aggregate all this in one place, and we'll push it out. Here's where you sign up. Here's where you sign up. This is some of that information, but we will be listing this at covid19.colorado.gov in our vaccination section, including the clinics that we're moving around the state, which are for particular communities. Great success in Center and San Luis. We were able to do most of the age 70 and up in small towns, and we know that for those who don't live near a hospital, it is important to go to them, and we're going to continue that effort. We expect that next week, local public health departments will have the infrastructure in place to begin their planning for their share of the vaccines. Some already are. We actually have some of those websites are ready for 6 or 7 of those counties, and the rest will be available next week. So this is how you do it. This is all being done in real time. We applaud all of our partners for opening up their online portals quickly. They are contacting the people that are in their database 70 and up first, but they will also be taking signups from the general public if we have somebody 70 and up who simply hasn't ever been to a hospital. There are a few healthy over 70s who've never been to a hospital. That's wonderful, and therefore you're not on anybody's list, and you'll sign up as a member of the general public. As I said, I think UC Health will have that by this weekend. And they're already, our priority, get into the arms of 70 plus, and of course, equity, geographic, rural, urban. We want to avoid disparities on income and race, and really make sure that we reach that wildly important goal. We call them WIGs in my administration, wildly important goal, WIG, 70% of people 70 and up by the end of February. That is our goal. That will have a profound impact on reducing the deadly nature of the pandemic. We will still lose people after March, and sadly, it'll include young, healthy people, but we expect that we can reduce our fatality rate by 3/4. That's very, very substantial. Our hospitalization rate by 1/3 or more once we successfully protect Coloradans aged 70 and up so that they can enjoy many more years of their life in good health, and also have more of that normal socialization that they have with family members, with their friends and others. It is a exciting priority to be able to talk about by the end of February. We expect 70% to be protected. We will continue that work after February, but we know that after that 70%, that next 10% will be harder to get to 80%. There'll obviously be some folks who don't want it. But look, if you're age 70 and up, you should want this. When you look at the numbers, your risk is 500 times greater than a healthy 20-year-old. 500 times greater. You're not twice as risk, not 5 times the risk. If you're in your 80s, 70s, your risk is 500 times greater. So please, get the vaccine, sign up. You might get it next week. You might get it in 3 weeks. You will get it by February 28th if you seek it out and want it. And that's the goal of what we're operationalizing right here today. Back to school, very exciting partnerships on this front. As we indicated, we've talked about in our back to school task force, one of the very first things we said is we don't expect the vaccine to have a major impact on back to school. Why? Because you're not even immune when you get it. So even though we moved up teachers from April and May to March, you get it in March, you're not immune for a month and a half, right? First dose, second. So that's why we have the intense focus on how we can make schools safe. And we have this layered approach, meaning when you do all of these things, schools are one of the safest workplaces we have. And that means prioritizing testing for schools, which we have a very exciting announcement on today, contact tracing, mask wearing, symptom screening, absolutely critical for staff and also for parent, for kids, effective cohorting. So far, it largely has been effective. When there have been site-based outbreaks, you don't see a situation like you saw at In-N-Out Burger, where what are they at 160 people, one of the largest outbreaks in our state. Most of the school outbreaks have been 2 people, 3 people. It hasn't been 100 people because of cohorting. Social distancing and ventilation, simple as keeping windows open. Many schools are doing 3 feet of distancing. Hand washing, regular. Making sure that the extracurricular activities and vaccine prioritization that we talked about for educators. So when we do all these things right, and we've been working closely with districts to do this, schools are one of the safest work environments for teachers. and also reasonably safe for students. Most parents will want their kids to be back in person. Of course, we respect that there are some parents who simply don't want their kids to go back. Maybe it's grandparents or great grandparents raising their kids. They're at greater risk for their virus. They want to continue. Maybe it's a kid who online works for very well, and you want to finish that out. And we expect that that'll continue to be, 10 or 20% of the families will choose that option as many more recognize the benefits of in-person education. So what we're talking about today is that we're implementing a few of those key recommendations that were in that task force. One is around masks. To date, we provided 2.4 million masks to schools around the state. We are announcing today that we will continue through the end of the school year, and we will also include surgical masks. This is a surgical mask, right? So we have the KN95 masks for teachers that really want to protect themselves. These are similar level of protection for what nurses on COVID wards wear. They're extremely effective. But they're, not the most comfortable, and a lot of teachers don't really want to use that level of protection. Cloth masks are great, but this surgical mask is better than a cloth mask, not as good as a KN95 mask. We want to make these available to teachers, and that will be included in the delivery. Schools need to opt into this. There are many schools where they're, happy using their cloth masks and they don't want the surgical or the KN95s. But we want to make sure that any educator, and it's not just teachers, it's paraprofessionals, it's the person at the front desk, the librarian, many others, that if they want to have the highest level of protection that's available to them, if they're comfortable using cloth or a surgical mask, we want to make sure that that's available to them as well. So we're going to continue that throughout the entire school year. It's one of the key parts of our roadmap. I'm also thrilled to announce that we have some substantial news, and I want to thank Sarah Thunberg and Jill Ryan for the Binax Now testing partnership. Our state is going to be one of only 3 states that is able to participate in a program to make home use Binax Now tests available to all public and private schools who opt into the program through June. These tests can be used for regular screening. Teachers can screen themselves once a week. They should be used for anybody who's symptomatic at school. It can be a comfort to rule out COVID and know that it's a common cold, or to start the quarantine earlier to prevent the spread. They will also be used for regular surveillance testing. They come in little packets like this. They're extremely easy for home use. School districts or private schools will order the tests. Then they're shipped directly to the homes of students and staff. They can also be shipped to the school site itself and administered on site. And we're really excited about the transformational potential of this partnership. Testing is a key part of suppressing the virus, getting our kids back into the classroom. I'm so proud that we are able to provide this service to educators, school staff, students, and families, one of only 3 states in the country. Easy, cheap, accurate, accessible, rapid home testing. We've outlined with the superintendents many of the different use cases: symptomatic, exposed individuals, regular surveillance testing. School districts can have them shipped directly. There's telehealth that supports these appointments, and superintendents have the information on how to request these. We expect that Colorado school districts will have access to over 1 million tests per month. I think this speaks a lot to how we value education. I visited the Broncos in their bubble a month ago to meet with some Bronco players on social justice issues, and the way that they use testing and the way that other professional athletic teams have used testing to keep a safe experience for their teams is something that the rest of us couldn't have, right? The White House had it, the Broncos had it, the Rockies have it. Well, guess what? Now our schools will have that same level of intense testing that really only existed in the rarefied strata of sports teams and the White House, with 1 million tests per month available for teachers, schools, staff, and as our back to school report states, that with these layered protections, our school are lower risk environments. With a layered approach to safety, we can make them safer, and getting our kids back for in-person learning safely is one of the best things we can do. And with these critical tools, we hope that we can finish out the school year on a safer note. These next months are going to be a race against the virus. In order to win, we need to vaccinate as many people as possible, especially those that are most at risk. And until the general public is able to get the vaccine, we all need to do our part even more to prevent loss of life and further spread of the virus. We need to wear a mask whenever we're out around others, stay at least 6 feet from other people. The key one, with the prevalence of the virus where it is in our state, avoiding social interactions with people outside of your home and significantly reducing those social interactions. There is such a high level of prevalence of COVID-19 in Colorado right now that if you slip up, you could very well get it. Right with that vaccine on the horizon, with perhaps you, if you're over 70, or your parents or grandparents getting it in the next month or so, with many of the bus drivers and grocers and others getting it shortly thereafter. Let's not slip up. We've lost close to 4,000 people from COVID-19. Let's prevent unnecessary loss of life by just buckling down for a few more months and avoiding socializing with people outside of your home. For people that don't live with any, young and single, it means, if safest thing to do is not to socialize. I get that people have social needs, we're social animals, but maybe it's one-on-one with a date or with a friend, not in a group of 10 or 15 people in a party. Enormous difference in that risk profile of what you do, which affects not only you, but affects everybody. And it's really important that as this vaccination rolls on, that we double down on the precautions that we know are effective at preventing the spread of any variant of COVID-19. And we know that there might be more contagious variants that are with us as well, but it is the same techniques. Being around others, not being around others is the goal. Wearing a mask, keeping 6 feet. With that, I want to wish everybody Happy New Year. Very excited every time this goes, the vaccine, somebody goes, 70 and up gets it. I get super excited. I was so excited at the photographs from San Luis and Center, and more clinics like that across the state. UC Health's doing it, Centura, all of those great partners. I know it's been frustrating for many folks. Now we're probably, this is how you sign up. You'll get that information. But yes, 70% of people age 70 and up, which represents those who want to get it and are actively pursuing it by the end of February. What a triumph that will be when we achieve that wildly important goal. And we're happy to open it up for questions.
Governor Steve Stager from 9 News. I have 2 questions as always. The first for Jill Ryan, actually, and I'll have her answer that after I ask your question. But for Jill, your department told us last night that nearly 600 assisted living facilities haven't been scheduled for clinics yet. How confident are you that the pharmacies will be able to complete that on the timeline, knowing that? And what steps can the state take to help with that program as you outlined? But first to you, Governor, you've repeatedly and unilaterally changed Colorado's vaccine schedule and the dial-based COVID restrictions. Do you believe your actions have undermined the public's faith and confidence in your ability to serve as governor?
Well, I think they've increased the confidence because people have seen that we use science and data to guide our decisions. So when CDC updated theirs, which is what led to us updating ours, they said 75 and up. Then we really dug into the information and data in Colorado and find that 78% of our deaths were age 70 and up. So we adopted it and then actually expanded it a little bit, built on the work of the CDC and the top national scientists to make sure that Colorado's vaccination strategy, that everybody can have the full confidence that it is based in the principle of saving lives and ending the pandemic. And of course, that means prioritizing those who are at greatest health risk of hospitalization and death. Jill?
Sure, and thank you for the question. And it's so important that we get the residents of our long-term care facilities vaccinated as quickly as possible. As you pointed out, the federal government is running their pharmacy partnership for long-term care program, and they have the contracts with Walgreens and CVS to get that done. We've reached out as a state. We do not feel like it's going quick enough. We have offered technical assistance and staffing to help move that along. We will continue to monitor that situation. The timeline that we are providing is what we are hearing from the federal government, and we will continue to do everything in our power to help move that process along as quickly as possible.
And I would just say it is frustrating that that's the one piece that we don't have the really authority over. We can cajole, we can encourage, we can say we need to help. Potentially, if there's complete failure to deliver, we can bypass But right now, under the contracts that they're being paid for and executing, we do rely on CVS and Walgreens for that partnership, and we are continuing to make sure that they deliver on what was promised.
Hi, it's Jessica Seaman with the Denver Post. You said that Colorado has received 243,000 doses of COVID-19 vaccine. That's lower than the 270,000 doses that CDPHE expected to receive by the end of last week. Can you tell me why that number is lower than what was expected?
I'll let Scott Bookman is on the line and can reference that. There have been several weeks where we have received less than expected. I would say the quantity of the Pfizer vaccine has fluctuated more than the quantity of the Moderna vaccine. Let me turn it over to Scott to address that particular disparity.
Thank you, Governor. And yes, our count is a rolling count based on what we receive from Operation Warp Speed each week. And then a certain percentage of that is going to feed that long-term care facility program. And so we give part of our allocation, particularly the Pfizer, each week right now to CVS and Walgreens to feed that program.
Next question.
Hi, this is Mayo Davison from KOA in Colorado Springs, and I had one question. I was wondering, how was it possible for some districts to begin vaccinating staff, such as school nurses who are considered in 1B, despite some of those in 1A not receiving their vaccination yet?
So yes, school nurses are currently eligible as frontline healthcare workers. They would be the ones if a student has, the sniffles, they might take them into their office and might be exposed, and they might even be administering the school-based instant test to see if a student or even a teacher that has symptoms is accurately diagnosed quickly. So school nurses are very much like other nurses in hospital COVID wards and emergency rooms, eligible under 1A. And I know that Centura is working with school districts to do that. UC Health and others are. We would encourage all medical providers, including school nurses, to be vaccinated so that they can successfully administer care to others who might be COVID positive. Let me address your question more generally. 1A is ending, but not over. And 2A has started, 1B has started. What does that mean? There is going to be a trickle of folks on the medical side that have not been vaccinated yet and will be vaccinated in the coming weeks. But that 100% of the supply going there, that is over. Now, I don't have the exact percent, but it's probably, by January 15th, it'll be well under 50% of the supply is still finishing off 1A medical workers and school nurses. It is mostly 70 and up at that point. And the 70 and up has already started because many communities, they say, we all of our medical staff has been vaccinated. What next? We're ready to go. And therefore they're working on the 70 and up.
This is Katie Eastman with 9 News. As a follow-up to talking about school districts, there are school districts that figured out the logistics and were ready to go on vaccinations. And you said, hold up, wait. If they've already figured it out, why not allow them to go forward? And then on those rapid tests, realistically, how often are you expecting teachers and students to take those tests? Once a day, once a week, once a month? What do you think?
So yeah, that's really up to the discussion between teachers and county public health and their superintendents. There's 2 benefits of this testing program. One is the health benefit, and we can certainly lay out how they should be used from a health perspective, and we are. But the second benefit is the peace of mind that families and teachers and others have from the use of the testing, knowing it reduces their risk of exposure. And that's more of a discussion about how they want to use them. Again, from our perspective, we believe that having a test a week is very effective. Certainly anybody who's symptomatic should be tested on site. Additional surveillance testing in schools that have any cases. They can also be used to end quarantines earlier. So the guidance from the CDC, a quarantine can end after 7 days with a negative test. So on day 6, day 7, get tested. Could be students or a teacher, quarantine over. 10 days without a test, 7 days with the test. So there's a lot of use cases, and we encourage them to be used for a public health purpose that's legitimate and data-driven, but also one that meets the desires and needs of educators and others and members of the school community, including parents. This is your first question. Logistics on the easy part. I mean, we can set up a clinic anywhere. But what we did is we did move educators and school staff up. In our original time frame, they were in April and May. They are now in March, as soon as March, really as soon as 70 and up reaches that 70%. Our date is February 28th. The next group includes those who work in and around schools, and those vaccines will be prioritized for them 2 months ahead of schedule, which we're very, very excited about for the school community. All of the work around getting back to school was done knowing that the vaccine would not have an impact on this school year because of the delay between the vaccination and when immunity sets in, a month and a half. Now, there are two potential upsides that could occur that would substantially increase supply and allow it to be brought to educators and bus drivers and others earlier. And that would be, one, if the FDA chooses to split the Moderna vaccine and says the science shows that we can give half the dose and it is just as effective for people that are 21 to 55 ages. There has been consideration of that. I would say I would put that in the realm of more likely than not to not occur. The other one that is looked at is the Johnson & Johnson and AstraZeneca vaccines, both in clinical trials. If supplies come online, they will also be distributed based on the prioritization, which could mean that the time frame for some could be moved up if we have additional vaccine in the state.
Hi, this is Andrea Dukakis with CPR News. I believe you made the decision to roll back restrictions last week based at least partly on hospitalization data that may have been off by 20% or more. That's because Centura Health added additional hospitalizations to its numbers. I just wonder if you would have made the decision with this new information to ease restrictions, and if it's possible that this would mean you'd move restrictions back to red.
Well, we track hospitalizations daily. I'll turn it over to Scott on that issue. 905 people hospitalized as of this morning, down from a height of over 1,600. This does not, at this level, tax the ability of our hospitals to provide the best quality care to both COVID and non-COVID patients. But we watch this in real time. And of course, if people start socializing and interacting more or not wearing masks, this number will only increase. Scott?
Thank you, Governor. Yeah, just to follow up on that, that there was a data connection error that has been solved. But when we look at the state as the whole and our total hospital capacity, we still have a significant amount of hospital beds, both general beds and ICU beds across the state. And while we know that our healthcare workers are working round the clock and are certainly stressed by the amount of COVID patients, the total number of COVID hospitalizations has come down significantly since our peak on December 1st, and we continue to evaluate things. But right now, we do have a good amount of hospital capacity available.
And it will go back up if people aren't careful and double down on what we need to do to avoid spreading it.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado.
Sí.
Gobernador, ¿puede decirnos cuántos casos más hay de la nueva variante del COVID-19? Y otra pregunta, luego de que hayan pasado 2 días de que cambió a nivel naranja algunos condados, se ha visto aumento de casos. ¿Qué podemos esperar en los próximos días?
Otra vez, por favor.
Son 2 preguntas. La primera, ¿qué nos puede decir de la nueva variante del COVID-19?
Sí.
Si hay nuevos casos. Y la segunda, luego de cambiar a nivel naranja, solo han pasado 2 días y ya tenemos aumento de casos. ¿Qué puede decirnos al respecto?
Nuestros laboratorios están monitoreando esta nueva variante. En cuanto a los casos, esperando a ver si vamos a ver aumento, pero estoy optimista poco de que los coloradenses han puesto de su parte durante las fechas feriadas para evitar reuniones y proteger a sus seres queridos. Es más importante que siempre usar tapabocas y no ir a locales sociales con personas que no viven en su mismo techo. El segundo, naranja, ahora tenemos más espacio en nuestros hospitales y es posible hacer más de nuestra atención en la necesidad para puestos, para personas que necesitan ganar dinero, por ejemplo, en restaurantes. Y los restaurantes pueden abrir en todas partes del estado con más distancia entre las mesas. Pero la cosa más importante en los restaurantes y para los clientes es quién tú vas a cenar con. Si cenan con su familia en un restaurante que viven en el mismo techo, es un poco de peligroso. Pero si van al restaurante con personas que viven en muchas casas, con 6 personas en 6 casas, es muy peligroso ahora porque el nivel de coronavirus es muy alto en nuestro estado y en todo el país.
Good morning, this is Stephanie Rodriguez with Telemundo Denver. My question is for you, Governor. ¿Me podría dar un resumen en español de la Junta? Y también muchas preguntas que tiene la comunidad es dónde se podrán administrar la vacuna y también qué documentos o qué les van a pedir al momento de ir a administrarse esta vacuna.
Sí. Personas viejos personas más viejos de 70 años pueden recibir el vacuno en hospitales y clínicas clínicas comunidades de salud. Solo identificación se necesita, es una cosa con su edad. Puede ser pasaporte, documento de otro país, de certificado de nacio, certificado de identificación de Colorado, por ejemplo, de manejar o una identificación. Hay muchos tipos de identificación para demostrar su edad.
Hi, this is Erin Prater with the Gazette in Colorado Springs and Denver. I have a general question for whomever wants to answer. And regarding the mutation, have there been any additional cases identified? And how many potential cases currently have been identified as well? The second question is for the governor. This spring you spoke about attacking the virus with a scalpel and not a sledgehammer. And now you're speaking about, the move from red to orange as one of regional cohesion. So why the shift? And in light of COVID levels that are rising again in the state, do you feel that moving red counties to orange was potentially premature, also in light of this mutant strain? Thank you.
Jill, do you have any updates on the new strain?
Governor, only to say that the state has identified 2 cases. I will tell you that we do, our lab is doing a great job at monitoring this. They do an initial run with all of the PCR tests that come in, and then if those tests are missing a certain protein, then they go on to do additional testing. Additionally, for any other labs in the state that are conducting this test, that are doing the initial screen and finding the same thing, they are sending those samples to us. So as we determine that folks have the variant, we are issuing isolation orders and asking them for their contacts to quarantine, just out of an abundance of caution. And everybody's been very cooperative on that front, but we'll keep you updated as we know more.
As we get information, that will be fully transparent and made available publicly. On the second question, so there is a very high level of coronavirus present in the entire country, many states experiencing their peaks, including Arizona and California. In Colorado, we have less hospitalizations than we did 4 weeks ago. We're down to just over 900 from a peak of 1,600, where it was really getting very close to having to activate the additional facilities that we had. That was something we were monitoring in real time. Had it kept moving that way for another week or two, that's where we'd be. Fortunately, it moved the other way. And remember, only about 20% of the spread of the virus is affected by all of these public policy decisions we're talking about. 80% is just people's personal decisions and what they're doing. And so really that is the place to focus. With regard to restaurants opening, it's what you do in a restaurant, not the fact that it's a restaurant, right? So if you go out with your family, those you live with, to a restaurant, that is low to moderate risk, not zero risk, just as shopping in a grocery store is not zero risk, but it's low to moderate risk to go out with your family. What is high risk is meeting people from different households in any environment, a restaurant, in a private home, wherever. If there's 6 people from different households that get together, there's a very good chance that one might be contagious with coronavirus. Boom, it goes to 5 people. Unmasked, more than 15 minutes, contact in close vicinity is what spreads this virus rapidly. So I call upon the people of Colorado to avoid socializing with people outside of their homes, to wear masks around others, and to be extremely cautious because of the high prevalence of the deadly virus in Colorado.
Hey, Governor, Jesse at the Colorado Sun. One follow-up on the question that Aaron asked. Ms. Hunsker-Ryan, is that 2 total cases or 2 in addition to the one that we already knew about of the variant? I'm wondering if you have any updates on, how many suspected cases you guys are looking at. And then, Governor, I wanted to ask you another question about the dial system. We found that more than 40 counties still had red level metrics for at least one metric, but you moved them back to level orange. So what's the point of having the dial system or the metrics if they don't really matter and the state's not following them?
Jill, did you want to address yours first?
Sure, Governor. So we have 2 confirmed cases total, and I don't know if Incident Commander Bookman knows how many more we're in the process of sequencing to determine if there are additional cases.
I can't give you a precise number because there are any number of different reasons that we would be doing sequencing on samples. It is not just the S dropout protein that would drive us to do sequencing, but we do have a robust surveillance system in place. We're working with other labs across the state to ensure that we are evaluating this. We continue to partner with the CDC and doing all that we can to identify every variant, not just this variant, but there are others as well that we are looking for to make sure that we have a good picture of what's happening in the state.
So there are 3 main criteria that drive the dial: incidence level, trend, and looking at 2-week trend, 1-week trend, and hospitalization data. Our North Star, we've made very clear from the start, is hospitalization. That is what we look at if there would ever need to be a county that would ever have to go into purple or lockdown if they're exceeding their hospital capacity. Red, the stage just short of that, is not designed to be a long-term intervention. It is an extremely extreme step. I think I'm grateful for the forbearance of the people of Colorado to be able to live with that for several weeks. The effect was positive, hospitalizations down, trend line down, incidence level still higher than we would like. So 2 out of 3 metrics being met. We look forward to a robust discussion with public health authorities, scientists, and others to discuss how to better relate the 3 criteria that we use in a way that makes sense and is predictable with regard to the use of the dial.
Governor, Chris Vanderveen over at 9 News. I think if there's been any sort of universal feeling that we've felt in our newsroom over the last week or so, is that there appears to be a massive amount of confusion over messaging, whether that be with the dial or the 5-star system, or with teachers, with doctors, with parents who can't get through on lines to their providers. Is there any responsibility that your office needs to take for some of that confusion over the last 2 weeks based upon the messaging that has sometimes come, at least in the minds of some, in haphazard form?
Well, look, there's 2 ways to approach this. One would be you wait until everything is perfect, till web portals are set up to and the systems are in place, and you don't announce anything until then. The other way is what I think is the path that makes sense to save lives, which is, of course, more chaotic because you're building the car while you're driving it. But in the meantime, you're getting the vaccine into the arms of 70 and up. And our state is one of the leading states in doing that. So yes, it was announced before all of the partners were ready, before all the public health agencies were ready. rather than delayed. I believe a delay would have been very costly in lives. And we want to show that we have the urgency that the moment calls on, which means moving forward at the fastest rate possible. I mean, the fact that those 250 people in Center and San Luis were vaccinated, that UC Health has vaccinated thousands of people over age 70 that will garner protection, equates to saving lives. So we want to get it done. Rather than wait till everything is queued up and ready and neat and organized, we want to convey that this is a crisis. Extreme times call for extreme measures. The chaos is not desirable, but the fact of going as quickly as possible, the benefits of going as quickly as possible to get it into the arms of folks, and it far outweighs any benefit of delaying until everything is lined up. I would add there have been states that are delaying, presumably until more things are lined up, and as a result have far less people vaccinated than Colorado does. I don't know if that's a deliberate decision they made or not, but they're in effect delaying. Next question. I think we have time for one more question. King Connor, is there one from Liz Gilardi, or is she having trouble, or did she already ask hers? Connor, if you want to go to one more. Let's allow a second question from somebody.
Hi, this is Erica Meltzer from Chalkbeat. I had a question. Yeah, I had a question about testing and a question about vaccination. First, on the testing, are you going to be able to make any additional contact tracing resources available to school districts? My understanding is that these rapid tests are most effective when there's some infrastructure around them for how to respond to the positive test results. And then my question on the vaccines is, we've heard of a number of situations where teachers were able to get appointments at Safeway pharmacies for their vaccinations. And I'm wondering if you're asking Safeway to cancel those appointments, or if those, individuals, however many they are, should go ahead and get their first shot.
So we're not aware of that. Safeway does not have a large number of vaccines, and I think they plan to be a partner for prioritizing their own workforce. They plan to do initial discussions where they plan to do that internally, but that also is early March. So they haven't yet vaccinated their own workforce. So I don't know. Maybe you can trace that down and get that over to Scott. But I'm surprised that happens somewhere. It shouldn't. It's not. They don't have the vaccine to do that. On the first one, yes, contact tracing is prioritized for schools. That is one of the key pieces of the roadmap. It's not just the testing, it's also the contact tracing focus from local public health with support from the state. But in addition to contact tracing, the advantages of the test are also when it comes back negative, right? The reduction in the need to quarantine or to isolate when in fact somebody might be ill with something else that is not COVID-19. So there's a benefit when it's positive on the surge of contact tracing, but there's also a benefit when it's negative in that delay of several days that otherwise might occur, as well as in the surveillance screening to identify outbreaks even earlier and prevent them from becoming larger. So a number of benefits. That's why testing, one of the key pieces we promised to educators, to schools, to parents as part of our roadmap to school, and we're delivering with 1 million tests a month. We want our schools to be able to have the same kinds of protections that have been limited to professional athletes and others in the prior months. Thank you, Erica. Thank you all. Happy New Year.